Hi, I'm Chris Miglino with Sequire, and we are here at the world-famous Roth Conference down in Data Point, California. I am here with Vijay Kotte with GoHealth, GOCO. Is it on NASDAQ?
NASDAQ.
Correct. Okay, so it's GOCO on NASDAQ, and GoHealth is in the business of helping people find insurance. And tell us about it. Tell us about the business.
Yeah, so what GoHealth does is we really focus on serving Medicare consumers. Those who are on Medicare, the federal program offered for those who are typically over the age of 65 or otherwise become eligible for Medicare, and navigate all the vast options available to them in healthcare coverage. So when you think about the average commercial consumer like ourselves, our employers might offer us 1 to 2 benefit options to choose every annual enrollment period, right, at the end of the year. A Medicare consumer gets offered up to 50 plans in their counties or in their communities, and they need help deciphering through all those options. And what we do is we focus on personalizing that experience to filter all the options down and then have someone hold their hand through the process to pick the right healthcare coverage for them.
Now, you said something there. You said in their community. Like, how much of Medicare is driven by the local, state versus the federal side of things?
Great question. In reality, it's administered at the federal level. But when they design benefits, when health plans offer benefits, they're specific to a county. So it goes within the state and all the way down to the county. So depending on where you live and what county you're in, you can have different benefits, even with within a major metro area. When you move from one county to the next, you'll have different benefit options available to you. So,
and how different are the benefits that people in different counties are getting?
They can be material.
Really?
They can absolutely be material based on your eligibility and which health plans decide to offer products there. So it's really challenging, confusing, and scary for most consumers to go through the process. And what we try to do is really simplify that. So, you want to ask your friends. A lot of people say, what should I do? But in reality, there's no one who can really decipher all that information and find out what's best for you without using things like our proprietary technology to do just that.
So your tech goes and looks at every county and understands exactly what's available in every single county across the country.
Yes, we were able to look across the entire country and then specifically filter down things based upon what you are eligible for. Because even if there's 50 plans in the county, you might only be eligible for 10 of them. And you don't know that until too late.
What determines the difference of eligibility for these people?
So sometimes it's your income level. It's where you live, what providers you use, right? If you have a specific hospital or a physician that you like to use, maybe there are only 3 plans that offer that hospital or those physicians. So you need to filter through all of that to get down the list of what actually works for you, that you're eligible for based on your income levels or other chronic conditions that you may suffer from. All those things can filter down to what products are.
So how do consumers learn about you? How do they learn about your service and engage with your service?
We have a number of ways that we actually make our services available and advertise those to the consumers. Most often, much of the activity of shopping for Medicare happens in the fourth quarter of the year. So October 15th through December 7th is our annual enrollment period.
It's Christmas time for you.
It's effectively Christmas time. And so in that period, we do a lot of mail, we do a lot of digital, and we run TV advertisements. And there's a lot of noise of TV advertisements as to who to reach out to. But we really focused on being consumer-centric, do what's right for the consumer, and offer all the right plans for them, even if it means they have to switch plans, or even if we don't make money doing it. We are all there to deliver peace of mind for the consumer, to say, you're on the right plan, don't do anything, or there's a better plan available for you, and here's what the differences are, so you can pick the right one that meets your need.
And with an older audience, obviously more and more people are technically savvy, but are most people, the elder people, doing this online, or are they doing it by calling? What's the method that they engage?
So it's very spread out and diverse in the way people access their options. Of the 65 million Medicare consumers that are in the country today,
it's a lot of people.
Half of them have chosen some sort of what I call a Medicare Advantage product, which is an HMO, a PPO, something separate from traditional Medicare. They choose one of these options. That's what we help them shop for. And so when you think about the different modalities for that, they can go to their local agent and sit across the table from them to help them do that, or they'll do it telephonically, which is predominantly what we do, or they do it through some digital environments direct with a health plan or otherwise. So there are lots of ways to get at it, and all those parties fortunately or unfortunately, are marketing to them in that annual enrollment period.
And do you work with the agents as well? Will agents engage with your platform?
We are actually agents.
Okay.
I'm an agent. Became a licensed agent as well when we started the transformation of this company back in June of 22. I became a licensed Medicare agent as well, and we employ thousands of Medicare agents who stay on the phone with our consumers to do that personalized needs assessment and what we have branded as our Plan Fit Checkup. We check your plans, we check your options available, and we check your changing needs every year to find the right plan for you.
And do you have outsourced agents as well? Like, do other companies engage with your platform to not just the ones that work directly for you, but are there outsourced third-party agents that are working?
There are other agents who actually work under our umbrella, and they use our technology. We provide them compliance oversight support to make sure they're compliant with the very onerous at time and complicated regulatory guidelines from the federal government as to how you can market and what materials you can put out. For a vulnerable population, you want to make sure you're cognizant of that. And then on top of that, making sure that they have the availability of the technology tools that we have to filter through those thousands of options available across the country, and then being able to do a nuanced, very specialized enrollment for a consumer.
How big is this market? Like, what's the magnitude of the size of the opportunity that you're going after?
It's 65 million total consumers.
65 million people.
There are 65 million consumers in the market today. 50% of those are already on managed care type plans, Medicare Advantage plans. And so that's just about 33 million today, and it's expecting to continue to grow as a percentage of that.
And what does that mean dollar-wise? Like, how big is that dollar-wise?
So from our perspective, what the dollar-wise? Well, you would say that that's $65 billion.
Okay, so you guys are doing around $734 million in revenue for the year.
And we are the largest in the space in the Medicare Advantage enrollment space.
And it's highly profitable, $75 million in EBITDA. And that's a big shift. I was looking at the financials. That's a big shift for you guys. So where can this go? You got, you're almost 300 million here. Where does it go next?
So we started a transformation. I think it's really important to highlight that. When I came in with a new leadership team, we changed the leadership team and restructured the company to be focused on the consumer as the center of it. Do what's right by the consumer. And in doing that, the company had burned over $300 million in cash in 2021.
Wow.
And as of this fiscal year ending 2023, we generated $110 million or $109 plus million in cash flow from operations. So a $400 million swing.
How did you do that? How did you make that happen?
We really focused on the math and thought about, well, first let's align the business around the consumer. Let's make sure we are staffed appropriately. So we reset the organization on the staffing and the tenure and the training for the associates. And on top of that, we invested in proprietary technology like our Encompass workflow, in addition, our Plan Fit checkups, and then restructured our contracts with our external parties, the health plans, to be able to reset the business and generate not only $400 million of a swing in cash flow from operations, material double-digit growth in adjusted EBITDA at the same time while we did that. So resulting in that $75 million in adjusted EBITDA last year.
That's great. And for the free cash flow shifting like that is amazing. So it's what a great story. And so now what's happening with the elder audience in the United States, right? What is it? Are we finding, there's been this talk about so many more elders moving into Social Security and whatnot. When does that kind of end and it starts to not be that story of, this many people shifting in? Or is that going to go on for the next 15, 20 years?
No, it's a great question. In reality, it's going to continue to grow. This is a growing market. People are living longer, and there are more that are coming. So on average today, 11,000 consumers are becoming new to Medicare every day. And that's going to continue to grow as we go forward. The average estimates are between 5 and 8% of the total, and it really has been continuing to expand at a great pace. So this is an expanding marketplace that is, got a lot of opportunity for us to grow, and we're very excited about that.
And it's ongoing. Like once somebody's in, they're in there for the rest of their life, right? It's can they go find other insurance other places, or is this once you get to a certain age, Medicare is your only option, correct?
No, well, there are a lot of different options that they could choose. They could stay on Medicare as a standalone. They could get a supplement if they wanted to. But what we're seeing is more and more consumers are moving to these Medicare Advantage plans, but they get an option to shop every single year. And so we've really reset our business to have a longitudinal relationship with the consumer to say, let's build trust today. And we want you to shop with us every year of your eligibility. And because your needs change every year, you might be diagnosed with another, condition. You might be on new maintenance prescription drugs. And the benefits that health plans offer change every year too. And so you need to reassess your plan fits every single year. And if you come with that, we believe we should be your trusted resource advisor for 20 shopping experiences over your eligibility, because it's really important to do that. So that is what we've rebuilt the business around, and luckily, right, at the same time, been able to reset the financial profile of the business while doing the right thing and making sure we're compliant with where the regulatory agencies at the federal government are trying to go.
On the when you're getting the consumers in, you think there's ever a chance that the government shifts the age a little bit higher, and what kind of impact does it have on you guys, right? Because people are living longer. People are, there's so much biohacking that's going on now that people are discovering anti-aging, reversing the aging process. Do you think there's ever a time that they start to shift the age a little bit higher?
It's a great question. I mean, I think people have been thinking about it for years because, there were a lot of factors when this program was put in place. Gosh, over 50, 60 years ago now, when they put the program in place of Medicare, of what they expected ages for eligibility and life expectancy to be. So there's been a lot of general discussions about it, but nothing of any serious note to change it anytime soon.
Right. And plus, that's a big political issue, right?
Very much so.
Yeah. It's tough for any politician to make that an issue and have it go well for them. Those are the voters. People are voting, and they're not going to like that.
No, that's absolutely true. And I'm not great at the politics of all the strategy around such things, but it would be a very traumatic thing for them to make that change for those who've been planning their retirement for years, right? And thinking they would have this at 65. If they were to change to 75 overnight and you're at 63, then what does that mean for you, right? So there's a lot of questions they'd have to answer as to what's the right inflection point if they were to actually entertain that thought.
And okay, so you see all the benefits across the country. What's the best county in the United States?
Oh, it's so hard to choose. Some of the richest benefits in the country happen to be in South Florida.
Really?
Ironically.
Imagine, right?
They have the provider networks are very integrated. There's a lot of value-based care. The clinic model is one that really looks holistically at the lifestyles of the consumers to integrate them in, so they're able to offer very attractive benefits because they do change a lot of people's lives. So it's there are a lot of communities like that throughout the country, but, it's always been South Florida has had a unique opportunity.
Well, thank you very much. I appreciate you coming here to meet with us today. GoHealth, GOCO on NASDAQ. Vijay, thank you very much. I appreciate it.
Thanks for the pleasure.